Life follows a guaranteed trajectory, whether we like it or not. Being knowledgeable and honest about that trajectory is empowering. When it comes to our health, it's wise living in a manner that altogether avoids speed bumps, instead of plowing right through them and heading to the mechanic to deal with the results. When it comes to our health, perhaps the greatest tool in our arsenal is physical activity. It's about so much more than just looking good and feeling confident. What's important to consider is that our bodies are systems designed for survival in the now. If your body is only ever subject to being in a restful, sedentary state, it will only ever be prepared for that state. As we age, this fact becomes more and more important to consider, because the body doesn't adapt as quickly as it used to, and it can suffer the consequences of sedentarism much more quickly than somebody who's in their 20s. On our website, we will discuss some of the diseases associated with a sedentary lifestyle and aging, such as dementia, sarcopenia, cardiovascular disease, chronic kidney disease, non-alcoholic fatty liver disease, and all-cause mortality. What is clear from the research is that physical activity is strongly correlated with being protective against these conditions, oftentimes reversing their progression. The CDC's own recommendations for physical activity fall closely in line with the research findings. According to them, all that's needed to reap the benefits of physical activity is 150 minutes of moderate intensity aerobic activity and 2 days a week of muscle strength training. Aerobic physical activity is considered anything that gets you breathing harder and gets your heart rate faster for a prolonged period. This may describe some of your daily activities such as mowing a lawn, walking a pet, or walking or riding a bike for transit purposes. Some other options are naturally running and jogging, power walking, tennis, and water aerobics. Generally speaking, the higher intensity, the more benefit the activity will provide, but what's important is that you stick to it and enjoy yourself. Muscle strength training, or resistance training, and aerobic training can overlap at times, but what's important is that the muscles are being worked in ways that are beyond what's normal for them. The muscles can be strained in such a way, from the act of pushing water out of the way while swimming a lap, or supporting yourself in a downward dog position during yoga. If one prefers to lift weights the traditional way, or use exercise bands, it doesn't have to involve a lot of weight either, so don't be afraid to pick up the 5-pound dumbbell. Group activities are a great way to encourage physical activity in yourself and your friends. Participating in a group activity like hiking, yoga, water aerobics, etc. is a good way to increase your enjoyment of physical activity while keeping yourself and your friends encouraged to be active. Exercising with others can keep you accountable and help you reach your personal goals. A unique barrier to physical activity you may experience more as you get older is medication side effects. When having discussions with your healthcare provider about your prescriptions, it's important that you also discuss your ability to perform physical activities while using those prescriptions, as this is a very important factor in your health that's often disregarded. A week of exercise can take any form that works best for you. If you want to do yoga every day, great. If you enjoy morning power walks, great. If you want to train like an Olympic weightlifter, fantastic. Whatever it takes to get you moving and stay moving. It may have the most substantial positive effect on your health of any single thing you can do. It's recommended that you speak to your doctor and seek training to get you started, but once you start, never stop.